The last part of Lecture 13 will be about coronaviruses. And so there are really three we care about. There are a bunch that cause the common cold, and we don't think about them very much. But these are the three: SARS-CoV, MERS-CoV, and SARS-CoV-2, which causes COVID-19. The first one we'll look at is MERS, Middle East Respiratory Syndrome. This is very recent, and it didn't spread outside of the region, which is lucky because it was very dangerous, and it did kill a large fraction of people who got it, from what we can tell. It seems to have required close contact for spreading, so not as transmissible as COVID. And neither was SARS. So SARS caused a huge outbreak in 2003, 2004, and public health departments all over the world sprang into action to do contact tracing and quarantining. They wanted to know everybody who had been exposed to someone with SARS, and the thought was, if you quarantine those people, it will stop. And so in a few cases, there were local outbreaks, like in Toronto, for example, but eventually they were able to quarantine most of the people, and it didn't spread any further. This disease was scaring people because of the known cases, a large fraction, like 10%, seemed to be fatalities, and there were famous examples of a big super spreader event that happened in a hospital respiratory unit. And so a patient got that, and a lot of the healthcare workers got it. And so they said famously at one point, there weren't any nurses left to care for people because they were all sick with SARS. This caused kind of a severe respiratory distress is what it caused. People had a lot of trouble breathing and needed ventilation. A large fraction of the people needed those things. We compare that with COVID, and there's a much smaller fraction with COVID who would need mechanical ventilation. And we'll get to that. When people were likely to pass this disease, SARS, when they were likely to pass it on, is when they had their symptoms. That made it a little bit easier to avoid infecting people, because people knew they were sick, and most people would have known they were sick. And we'd compare that to COVID, where a lot of the spread that goes on is from asymptomatic people who have no idea that they're sick. Or, I mean, they're not sick, but they have no idea that they're infected. And that's why we can't stop COVID. We can't quarantine our way out of COVID. And if you go back to January, February, March 2020, everything you read about was trying to quarantine people flying in from other countries, trying to watch people who were traveling, because we thought that was SARS. I mean, I didn't think anything I didn't know, but the World Health Organization and the CDC thought it was SARS all over again. And it wasn't. SARS caused basically a bad pneumonia that could lead to, acute respiratory distress syndrome. And there's no treatment for it. I mean, other than the supportive therapy you'd give someone who's having trouble breathing. So that brings us to COVID. COVID has a lot of signs and symptoms. It can present a lot of different ways. This is just the list on the CDC website. This website, you can get this list and a lot of other good information. There may be other signs and symptoms, we just don't know. I remember back in March 2020, everybody said cough and loss of taste. So a dry cough and loss of taste. But now we know there are a lot of other things people can experience. So primarily it's transmitted through respiratory droplets. From epidemiology, we can see that it seems to be mostly spread by people who are close together and likely talking to each other. And that's the droplets. In some known cases, people got it from other people who they were not close to. So people in the same large room got it from someone on the other side of the room. And the best people can figure out is that that was caused by the actual airborne route. The actual tiny microscopic aerosols were spreading it in those cases. So we don't know what causes those, but in those super spreader events, it seems to be capable of spreading through the actual airborne route. And that is, well, that's another thing. Right. So the current numbers, every day in the U.S., there are about 100,000 people who test positive for COVID-19. And that's the lowest rate it's been in a long time. After the surge, or the surges that happened over the winter, in the news, it seems like COVID is disappearing because the surges are over, but still 100,000 cases daily. In the U.S., we have lost over 500,000 people to COVID by now. And more than 10% of the people in the U.S. have had it. And in some places, it's more like 30 or 40% of people seem to have been infected. This virus does a lot of things to the immune system that let it spread through the body. And those are, well, they're way beyond me, that's for sure. And I'm not sure that there's a great, I don't think anyone has put together a clear picture of everything it's doing. That's something we all kind of want to see, is what exactly is it doing? And it's doing a lot of different things, and the research on that is still ongoing. What we can say is how it replicates. And it replicates like a coronavirus. It's not that important to us, but it gets into cells by attaching to the ACE2 protein on the cell surface. So any cell that expresses this ACE2 protein is susceptible to SARS-CoV-2. So if we look at what cells typically express this, we can kind of see what's happening in the disease. So epithelial cells in the lung, they get infected, and that leads to pneumonia because they're directly being attacked. Enterocytes in the small intestine, that's leading to diarrhea and people spreading the virus in their feces, and that allows us to detect it in cities. We're seeing cardiovascular endothelial cells. That lets it spread throughout the whole body and cause different symptoms in different places. And then nasal and pharyngeal epithelial cells, when they're infected and they're shedding the virus, a person can spread the virus through droplets or coughing or sneezing. And this is what makes it transmissible. This is what makes it very contagious. So those are the things it does. And then the last sort of numbers I want to give you are the best estimates I've seen about what happens to a person who gets COVID. What if you choose a random person, what is likely to happen to them if they get infected by COVID? A random person has a 40% chance of an asymptomatic infection, very roughly. That is a wild estimate. And all these numbers are based on that number being true. Of the remaining cases, we know how those spread out. We know the relationship of all these other numbers to each other. We just don't know this number perfectly. But we know it's very roughly 40% asymptomatic. Well, about the same number are mild, and that mild is a silly way to describe it because they're having an influenza-level disease with malaise and pain and fever and nausea, and just a very unpleasant, many days long disease. Severe cases are worse. These are people who are having trouble breathing, and they have to be hospitalized. And so roughly 7% chance of the severe case, and roughly a 5% chance of a critical case. And this is where a person would definitely die without hospitalization. And half of these people do die. So, right. So of these critical cases, roughly half died. And this is all based on data from the Chinese outbreak. They have a better ability to test large numbers of people and to force them to be tested. So we get good data. What this doesn't look into at all is the long-term effects of COVID and the lasting complications. And there are lists. Actually, the same website has lists of the different things we're seeing, including what appears to be permanent fatigue, permanent damage to the heart, apparently permanent brain damage in some people, mental fog that's causing them to quit their careers, and this mysterious multi-system inflammatory syndrome in children, where a week after the child recovers from COVID, they come down with massive inflammation all over their body. And that's a life-threatening situation, and they absolutely need to be hospitalized in that situation. And now that seems to be happening in adults too. As of the day I'm recording this, I just saw a report that this has been seen in adults now also. So those are the things COVID does. We have improved our treatment of COVID since March 2020. Now we have something like a 3-fold higher survival rate than we did back then. And that's because there have been a lot of patients and a lot of people have tried a lot of things and seen what helps. We don't have any specific drugs other than antibodies we can purify from people. It seems likely that a company will start producing transgenic antibodies that we could use in large numbers, but that hasn't been widely available yet. And that would be the only direct antiviral thing we would have for COVID. So for most people, all they're going to get is supportive care. And to prevent it, all we can do is social distancing. That has been incredibly important because that has been what's allowed us to have this improvement in survival. When we have a surge and the hospitals get overwhelmed, like we saw in a lot of places in the US over the winter, critical care can't be provided at the normal standard. If the nurses have too many patients, they can't be as fast as recognizing things. They can't respond as quickly. And so we potentially lose these improvements. And so in some cases, we did lose those improvements. And it's only when the surge is over, if levels go back down low enough, our clinicians can rest a little bit and get the proper staffing ratios, then we'll be able to really improve our care. But what would have happened if we didn't do the social distancing, if we didn't do the lockdowns, if we had just let this virus go, every hospital in the country would have been overrun, and we wouldn't have been able to give care to the people who needed it. We could easily have had 10 times as many patients as an intensive care unit could handle. And from the numbers we've seen, that would have happened by last July if we hadn't done the lockdowns and the social distancing. By last July, we would have lost a lot of people who just couldn't get healthcare. And so people in the severe category who were not in the critical category, but that severe category, those people would have been at risk of death from COVID. And that's all along, that's been the rationale for doing lockdowns and doing social distancing. It's making sure that our healthcare system doesn't collapse. As we've already seen, every country in the world, even though the healthcare systems haven't collapsed, mortality has increased everywhere. And this is mortality from all causes. And we know there's some there's preventative healthcare that isn't happening, and there's a lot of other things going wrong because of this. So it is huge. So what I want to end with was a little bit more about this. Why did we get such weird conflicting information back a year ago in March of 2020? Well, it's because the people who knew the most thought we were seeing SARS again. They thought it was a severe disease in almost every case. They thought it was always going to make symptoms and always spread by droplets. And we found immediately it's not the same. Asymptomatic transmission is common. When virologists found that out, they panicked because that meant that this disease couldn't be contained, and it couldn't be contained. And aerosol transmission happens in some cases. So we never could have contained SARS-CoV-2. We never could have prevented it from coming into the US. And so this asymptomatic spread, asymptomatic transmission is the secret weapon of COVID. It's what has allowed it to spread across the world so fast. There's nothing we can do to stop it other than the vaccines that people are taking right now. So the good news is that we have multiple vaccines, and hopefully by the summer we will have been able to get widespread vaccination, and we will see infection rates drop. That's what we're hoping. So cross your fingers. All the rest of the slides are for your curiosity. So flip through them, see if there's anything you're interested in, but you're welcome to skip all of the slides that have these letters in the upper right-hand corner, and that is all the rest of the slides. So good luck, and I will see you later.